Good afternoon. Today is Tuesday, July the 16th. This is the Public Health and Safety Committee. We do have a quorum with myself, Council Members Benton, Bradford, Gregg, Huffman, Nash, and Sepulveda, and then a couple others will be coming in a little late due to traffic issues, so I'll add them whenever they get here. We're going to go ahead and start off with our legislation. We do have a guest speaker today, so I want to make sure that we can accommodate him and also accommodate our update from Office of Homeless Services related to the materials that Mr. Clendenning has provided. And so my intent, kind of looking at everything, I have everything on a consent agenda except for item number 7, which is RS 2024-598. Does anybody have any of the other items that they would like to pull off of consent? I'm not seeing any hands, so we'll go ahead and get started reading, and then I'll check again to see if everybody gets excited about something and then we have to pull it off. So we'll start with proposed consent item number 1, RS 2024-581 by Evans and Welsh, authorizes the Metropolitan Mayor to execute an interlocal agreement for the Northern Middle Tennessee Local Workforce Development Area in accordance with the Workforce Innovation and Opportunity Act. Item number 2, RS 2024-582 by Porterfield and Evans, accepts a grant from the Davidson County Farm Bureau to the Davidson County Sheriff's Office for the enhancement of the Sheriff's Office horticultural/arboricultural program. Item number 3, RS 2024-583, Porterfield, Evans, Welsh, and others, accepts a grant from the Tennessee Department of Transportation to the Davidson County Sheriff's Office to provide litter pickup and litter prevention education within Davidson County. Item number 4, RS 2024-584 by Porterfield and Evans, accepts the terms of a cooperative purchasing master agreement for urgent purchases for repair and maintenance supplies for jail facilities for the Davidson County Sheriff's Office. Item number 5, RS 2024-588 by Porterfield, Evans, and Ellis, approves an interlocal agreement between the Emergency Communications District for Nashville and Davidson County and the Metropolitan Government for the provision of services and reimbursement of costs pertaining to enhanced 911 services. Item number 6, RS 2024-597 by Porterfield, Evans, and Welsh, accepts a grant from the Tennessee Department of Finance and Administration, Office of Criminal Justice Programs, to the Office of Family Safety to plan and implement the Tennessee Family Justice Center's statewide conference. Do I have a motion? It's been moved and properly seconded. Is there anything that needs to come off consent before we take the vote? Councilmember Huffman, I don't want to hear wildflowers come out of your mouth.
Nothing about wildflowers,
okay,
ma'am.
Thank you.
Number 3, 2024-583.
Okay, item number 3, we will pull off of consent. Any other items that need to come off of consent? Can someone renew our motion for the consent agenda? Okay, it's been moved and seconded. All those in favor, please say aye. Aye. Anyone opposed? Anyone not voting? Okay, we recommended approval in favor of our consent agenda, 7 in favor, 0 against, 0 not voting. We'll go back up and pick up item number 3, RS 2024-583, accepts a grant from the Tennessee Department of Transportation to the Davidson County Sheriff's Office to provide litter pickup and litter prevention education within Davidson County. Do I have a motion? It's been moved and seconded. Any discussion? Councilmember Huffman, you're recognized.
Thank you, Chair. Do we have anybody from the Sheriff's Department here?
Oh, it looks like we do. Hello, welcome.
Perfect.
Let me recognize you at the podium, and if you could introduce yourself to everybody.
I'm Christy Bratcher, Deputy Director of Finance.
Thank you.
Awesome. Thank you, Chair. First off, I want to indicate that I'm in favor of this. I just had a couple of questions regarding how the litter pickup process works.
Okay.
First question, do you have like zones that you focus on, or do you take requests on demand, or how does that work?
So they do take requests. If you call into our correctional service center, they will schedule you to be picked up if you have bulk items and things like that. As far as the litter grant, that covers the state highways and main roads within the county. So wherever, and the correctional service team is great. They schedule, they cover how many miles they cover each month and make sure it gets taken care of. So.
Thank you. And on the state roads, you coordinate with NDOT and TDOT to make sure everybody's on the same page.
Yes,
about that.
NDOT is also included on this grant. They actually do the beautification and education part of it, and we do the litter pickup part.
Okay, and last question. Every year, how much trash do you think you pick up? Do you have a number?
I don't. I could pull it. We have it on every monthly report. It's added to that, and I looked at it today, but I don't remember what it was.
If you could just get that to us, it'd be good info for us to spread to our constituents. Thank you.
No pun intended.
Yeah, there
Thank
you
you
go.
very much. Any other questions? Okay. Thank you very much for being here and answering our questions. Do we have a motion?
Second.
Okay, it's been moved and seconded. All those in favor?
Aye.
Anyone opposed? Anyone not voting? All right. We recommend approval, 7 in favor, 0 against, 0 not voting. Let's go to our last item on our agenda. That is item number 7, RS 2024-598 by Porterfield and Evans. Approves amendment number 1 to a sole source contract between the Metropolitan Government and Barbara L. Brown to increase the value and extend term of the contract. Do I have a motion? It's been moved and properly seconded. I want to open it up for discussion. We did have some discussion in Budget and Finance yesterday, and there were some additional questions. And so I'd like to recognize Sergeant Mike Kotz at the back podium for kind of the same overview that you gave everybody yesterday, and then with the additional flavor from the questions.
Yes, ma'am. Thank you, Chair. My name is Mike Hotz. I'm a sergeant with the Metro Nashville Police Department. I work in the Specialized Investigations Division, and I supervise the overdose unit. So a little bit about what we do, and forgive me if I'm repeating some of the things I spoke about yesterday. But we do community overdose outreach, harm reduction, and community education in terms of the overdose epidemic, as well as narcotic trends within our city. This pertains to Barbara Brown. She's our overdose prevention specialist. So what Barbara and I do, we work hand in hand. We monitor overdose data in Nashville. And we identify communities as well as geographic locations in need of overdose outreach. If we notice a spike of overdose activity, whether it's fatal or non-fatal overdose activity, we're able to react to that very quickly and bring resources to those communities. So Barbara's been with the overdose unit, and she's been an integral member for 2 years, almost 2 years now. And in that time, she's coordinated over 100 community overdose outreach events. And between her efforts and my efforts, we've distributed more than 1,500 overdose reversal kits throughout the community. And each of those overdose reversal kits contain literature about individuals who may be seeking treatment, but more importantly, it also contains the life-saving overdose reversal medication, Narcan or naloxone. And each of those Narcan kits has 2 doses in it. So with the 1,500 kits that we've distributed, that's over 3,000 doses of the life-saving medication that's been introduced into our community. Barbara is really a pioneer in the overdose outreach field. She is a retired registered critical care nurse. And more importantly, she was the first ever regional overdose prevention specialist, or ROPS, R-O-P-S, in the state of Tennessee. She literally wrote the blueprint for our response to overdose and overdose outreach in the community. She has an incredible knack for communication with individuals. She's worked with individuals with substance use disorder and opioid use disorder for a significant portion of her career. And watching her in action and speaking to individuals who are suffering from addiction and talking to them about treatment resources is something to behold. Her and I have many different resources, some of which she has developed, some of which I've developed, where if an individual is presented to us and is ready to receive treatment at that exact moment, we have a significant amount of resources at our disposal where we can get an individual into treatment, whether it's medication-assisted treatment, MAT, or whether it's intensive inpatient 90-day or otherwise rehabilitation. Some of those resources are next door, Samaritan Recovery Community, the Mental Health Co-ops, Community Overdose Response Team, and many different facilities, such as private institutions we partner with, such as Wayspring, Treehouse Recovery, and Behavioral Health Group, And the list goes on. And that's an important thing about what Barbara brings to our table. Throughout her career, she's established all these networks within the overdose and addiction community. And whatever we need to bring to the table for a particular community within Nashville, whether it's clothing or food or shelter or social services, mental health, or treatment resources, she came equipped with that tool belt and really got us running from day one.
Sergeant Hotz, I want to interrupt for just a second and just kind of check in with the committee to see if any of you have questions. It looks like Councilmember Sepulveda does. So let me recognize her.
Thank you, Chair. Thank you, Sergeant. I have a question in regards to language access and translators at these facilities, or as you all are processing all of these people. Is that something you all do?
I don't know specifically. Could you clarify the question?
So I've been reached out to throughout the years from various members of the Latino community who want resources as far as getting family members or loved ones into some of these facilities, but they don't speak Spanish. Is that something you all are looking at?
Yes, it is certainly something we can improve on, but it is something that Barbara actually identified towards the very beginning of her contract with us. So she has produced some literature like flyers in Spanish language that we've been able to give out. We also, the private companies tend to have Spanish language translation immediately available. And more importantly is our engagement, I think, within the Hispanic community. We're doing a back to school event in Madison. This is probably our largest event of the year, where we're able to provide Narcan and naloxone. It's put on by a Spanish language radio channel. Forgive me, I can't remember the name of the radio channel, but it's something that is very much on our radar. And also just from the police department side, if we are ever doing an overdose outreach event and we're able, and there's a language barrier, we have access to different tools at our disposal for the police department where we could have translation services available.
Great, thank you. It's just that if you're doing a holistic approach with therapy and all of that, having someone who speaks their language is something that has been mentioned to me on a number of occasions. So I do appreciate you all trying to bridge that gap.
Thank you, Councilmember. Any other questions for Sergeant Hotz? Councilmember Gregg, you're recognized.
I can't tell you how excited I am to hear that you have the resources for recovery should someone seek that option. We tell stories through stats. Do you have any stats of how many people have accepted recovery through your program?
There are certain restrictions when it comes to HIPAA.
Obviously, we can't do names, but I just wondered if you had head count.
If I had to estimate just personally between Barbara and I at different community outreach events who I know firsthand who have gone into some form of treatment or another, I would say it's probably well over 15 to 20. Recovery, as I'm learning, is a very difficult, sticky situation. And I've learned a lot during my time here. I was asked to found the overdose unit and build it from the ground up. And, you know, the recovery aspect is an important part of it. Recovery doesn't always stick the first time around.
Usually takes 2 or 3.
Yes, sir. And a lot of times, you know, people will reach out to us and say that they're ready. And then when we secure, in a quick fashion, when we secure some sort of treatment facility for them, whether it's, you know, 30 to 45 minutes later, they may not be able to receive it in that short period of time. So I definitely value our treatment resources throughout the community, and a large portion of that has been thanks to Barbara.
That's incredible. And I just wanted to say publicly thank you for that
Thank you.
work.
Thank you, Councilmember Gregg. Any other questions for Sergeant Hotz? Okay, Sergeant Hotz, I really appreciate you being here on day number 2 to answer people's questions. And I think we can probably move forward with a vote if that works for you. And thank you for your time. can anybody, do we have a renewed motion? I see a hand from Commander Nash. We got a second. All those in favor?
Aye.
Anyone opposed? All right, thank you. We recommend approval. 7 in favor, 0 against, 0 not voting. We'll go ahead and transition into our presentation from our guest speaker today. We have Dr. Maury Nation, and you might be wondering, why does Aaron have someone from Vanderbilt University here? The reason is because Dr. Nation came to into my sphere of influence because of the Department of Justice grant that we've been talking about around community safety with the health department. And so that's how I first learned about him. I was hearing his name several times, and then he reached out. We had a conversation. I thought it was worth him coming and sharing some information with us. So I'll read just a very short bit of his bio. Dr. Maury's clinical research focuses on understanding and preventing violence and bullying among school-age children. His community research is focused on understanding community and neighborhood qualities and characteristics that promote positive health and mental health outcomes. So he's here to share a little bit of information that kind of, I think, will provide us with some more insight as we think about the funding that we have around community safety and like how to best frame that. And so with that, I'm going to see if I can turn on the right microphone. All right, Dr. Nation.
Good afternoon. I want to start just with a little more of an introduction in that I've been here for more than 20 years at this point. So Nashville is my home. And throughout that period, I've been involved with a variety of mayoral administrations. And I list just some of the organizations and agencies that I've collaborated with over the years. So just wanted to give that as a little bit of a background as to where I come to this work from. And I have also had the opportunity to work both with the two major federal agencies that have taken violence and violence prevention as part of their major foci, the Centers for Disease Control, their injury center. I have both collaborated and consulted with them. I'm currently a member of their board of scientific counselors. And then also the National Institute of Justice, where I have served on review committees and am currently both do direct consulting as well as working on civil rights cases that come before the Department of Justice, education-related civil rights cases. So that's a little bit of the background that I bring to this. And, you know, I reached out to Councilwoman Evans back in May, just because of my observations of what has gone on over the last, really since September regarding violence and violence prevention. And what I will say is that since mid-May, a lot's happened. I mean, and one of the things that I would start by saying is thank you all for the leadership that you've shown even in the last couple of months, last 6 weeks, regarding the budget and making sure that violence and violence prevention and public and community safety has become on our radar in a way that it had not been. So I want to start by just drawing your attention to some things that you may have heard quite a bit in the news over the course of this year. The violence is down, and that is true. And these are reports, UCR reports produced by our Metro Police. And I wanted to present them side by side, year over year, just so you can kind of see what's happening and where it's happening. And I think there's a lot of good news here. I mean, one of the places that, the things that I would point out is that we saw declines in places that have traditionally been most impacted by violence. So if you want to compare year over year for the first quarter, look at North Nashville. And it's noticeable the decrease in the number of violent incidents. You also see that in South and to a lesser degree also in East. There's also some places where it doesn't go down or it stays relatively flat. So you see that in, say, Hermitage, where you see actually it pops up a bit. You know, one of the things, as I said before, is that this is for the most part good news. I mean, and we'll see this also when we look at the second quarter. A similar pattern. Violence tends to be seasonal. So what you're starting to see with the second quarter is that as temperatures go up, typically so does the rate of violence and violence incidents go up. So you're seeing that reflected here. But year over year, we're still seeing reasonable declines in the overall incidence of violence. So why would I reach out to Councilwoman Evans with concern? There's a few things that you don't see in these numbers that I wanted to point out. And I wanted to point them out in part because as I watched news coverage, I mean, I heard things being said about violence declining as if we had solved it in some way. What I would say is that the declines that we've seen so far in Nashville are similar to the same types of declines that we've seen nationally in several major cities. And it's kind of a little bit of a reversal of what we saw in the opposite direction at the beginning of the pandemic, where in many, many major cities, there was a striking increase. To my second point, while the year-over-year numbers are down, if you go back and look historically, we're still pretty high compared to numbers as recent as 2019. And what seems to be where we're settling in now is a success if we can keep our number of homicides, for example, at 100. If you go back to 2018, that number would be shocking. 100 would be shocking. And at this point, we're hoping to stay as close to 100 for this coming year. So I want to put these declines into a little bit of context. The last point is that I think what often hasn't been talked about is the fact that young people are overrepresented, even relative to previous years, in the numbers and the types of violent offenses that we're seeing, which doesn't, I mean, for a variety of reasons is problematic, both for the health and well-being of our young people, but it also doesn't bode well for what we would expect to see over the course of their lifespans as residents of Nashville. In terms of the sources of concern that I really drew me to reach out, and you know, this first one I raised, and I want to put a caveat on it in the sense that I don't raise it as a desire to attack or besmirch the O'Connell administration. I am a supporter, was a supporter, and am a supporter, and want to see the administration be successful. That being said, it has been remarkable that for most of the last 6 or 8 months, there has not been much of an articulation of a strategy as it relates to violence and violence prevention, which stands in a little bit of contrast to most other major cities and even past administrations here in Nashville. So I was concerned that I wasn't seeing people talk about what the administration and or city was going to do in relation to this. The second thing was the efforts that were already in place here in Nashville for in city governments seem to be shifted to Metro Public Health. And while conceptually, I think that's a good thing, and in that we are starting to talk about violence in terms of a public health issue. Metro Public Health has not traditionally been engaged in violence or violence prevention, and does not has not been part of the ecosystem of people who have been doing this work. And as a result, I mean, I think there's been a real loss of momentum and a real disconnect between what has gone on and what hopefully will go on in light of this moving from the city to Metro Public Health. Now, one of the things, because I've been doing this work for a while, I wanted to just kind of go through what I have seen over the course of the years in terms of the strategies that we've been using as a city to address violence. One of the things has been Cure Violence. It's a strategy that developed first in Boston and is effective in working with those who are at most high risk. I mean, you're doing street work usually at all times with people who, and trying to intervene with people right as they are making decisions regarding whether or not to engage in violence. One of the things that we know about this intervention is that it's not an effective intervention freestanding. That is, you don't reduce the rates of violence in the city just with Cure Violence. You keep those people at highest risk from engaging in it. But what we've seen in Boston and Chicago, New York, is that when you have a city that has lots of other marginalized and alienated individuals, is that when you remove one person, there are two or three others there to fill that spot. So it doesn't necessarily remove the overall threat of violence, even when you have a successful Cure Violence program. Second place where we've really seen emphasis and really impressive efforts is around restorative practices. So folks like Rafa Institute, Judge Calloway and her team working with young people to really try to figure out ways to not only correct, but also to reconcile young people with the communities and the people to whom they have offended. The third element of this, and it's probably best represented in the Village, is the act of building a community safety net. And this work really comes out of the work of a Princeton sociologist, Sharkey, who did a national study and found that communities that had a higher density of nonprofits actually had lower levels of violence, regardless of whether or not those nonprofits were specifically focused on violence. And one of the things that he concluded from that was that to the degree that we have a healthy ecosystem of people who are engaged in community and engaged with community, that's a good thing. Like I said, even independent of whether or not they are doing specific violence prevention. And I think that's one of the things that you see reflected in programs like The Village, where you are bringing together groups of organizations to do what they can in their communities to support their communities. And then finally, I would say that, across multiple previous administrations, you've seen emphasis on after-school programs, so NASA and Opportunity Now, so providing jobs and opportunities for youth during the summer. Again, one of those most high-risk periods where we see young people at risk for violence. So this is actually a pretty impressive array of initiatives and strategies designed to prevent violence. One of my concerns, again, was that we were not seeing much in the way of development of these over the past 8 months. And it was really, and again, I come back and say again, thank you all for the leadership that you showed with this recent budget to really put emphasis on and resources into supporting some of these strategies and making sure that they are able to endure. In terms of the issues and recommendations, I almost can say, you guys have already stole most of the thunder here, and that you've already engaged in most of this. I mean, I do want to point out that the decreases in the national trends. I just want to make sure that we don't take our foot off the pedal, so to speak, because we can say there are decreases. I mean, things can get worse than they are. I mean, and all we have to do is look 3 hours to our west, where a similar sized city will likely have 300, actually more than 300 homicides this year. So it makes a difference what we do. And it's important that we don't just say, take our eyes also off of this. One of the things that I think is important is providing some structure and direction to the violence prevention efforts. And I think being able to develop an office that's focused on kind of family and youth safety, I think really helps in that regard. It's a place where someone is paying attention and has passion for this work and making sure that it gets done. And then the last piece is continuing to invest in this infrastructure. And I think the investments that you all have proposed as it relates to things like the village and even my hopes are that the grant for Metro Public Health and Metro Public Health they will find a way to kind of plug into this infrastructure. That collectively we can make a difference in the types of outcomes that we see over this coming year. I will stop there and open it up for questions or comments. One of the things I will also put as a little bit of a piece of background, I did work with the team who wrote the grant that is now at Metro Public Health. So I know a little bit of a background on what the thinking was there and what the hopes were with that work. I'm passionate about the idea of wanting to see it do what it was intended to do. And I'll be frank in saying that I worry about whether it will get done, but I think with the things that you all have done, it makes me a lot more comfortable that it will.
Thank you, Dr. Nation. How about any questions from the committee? Councilmember Huffman.
Thank you, Chair. First of all, thank you for coming to this committee. Some of those numbers were shocking. I represent the 14th district, which encompasses the Hermitage precinct.
Yeah.
Obviously, those numbers caught my attention.
Yeah.
One thing that really caught my attention was a trend that I had assumed, but it was just kind of interesting to see it there, and that was in regards to youth involvement. Mm-hmm. You indicated that wasn't indicated in the report, but I'm curious to how we can get that information. And really what I'm interested in is the number of offenses and then also how many of those are repeat offenders.
Okay. And, it's one of those things we can do. I'm pretty sure we can pull those numbers for you. I mean, one of the things with the open data portal is that it helps us to be able to get data relatively quickly. To be able to look at it by age of offender, and age of victim. I mean, one of the difficulties is when cases or when there's not an arrest made or a case isn't closed, we can't always know what the age of the perpetrator was. It's one of the reasons why I talked about it as participation, because even from what we know, whether or not it was a person under 18 who was a victimized and or a participant, we still see that trend that our kids are more represented in these numbers than they have been in previous years. And I do think we can get that information for you.
Okay, thank you, Councilmember Huffman. Councilmember Nash, you're recognized.
Thank you, Chairman. Professor, great to have you here and your insights. A little background, I spent 33 years with the police department and retired as commander of the East Precinct. And with my community groups, I always said, these kids don't come from Mars. They're your neighbor,
Yep.
they're your cousin, your grandchild. And when we see people going astray, we got to find some way, someone to have some influence to get to them before they get to us.
Mm-hmm.
I worry sometimes that we rely so much on the juvenile court, or the police department, and oftentimes they're too far down the road for good outcomes. We'll try and beat them. Have you found a strategy that goes deeper into the community? Churches.
Yeah.
I cringe every time I hear the school to prison pipeline, because I think it's home to prison pipeline, and schools caught in the middle, and a bunch of other folks.
Yes.
So I would love to hear if you've seen some strategy that gets right down into the community better than maybe we're doing.
Yeah, and I thank you for raising that. I do a lot of work with metro schools, so I hear this conversation quite a bit about, how do we disrupt this trajectory? And it's interesting because, one of the things that, and I absolutely agree with you, is that to the degree that we can form significant relationships with young people, that's our best bet for preventing, poor outcomes among young people. And one of the things that you may find interesting is that in my work with the district, we've been looking at what kids do after school to see how big of a difference does it make. And one of the things that we found was that, to the degree that kids are going to something that is structured versus just going home and being or hanging out with friends or being in something that's unstructured, makes a huge difference in terms of their attendance and their achievement and behavior at school. And I think that's reflective of this process that you're talking about, which is to the degree that we allow our kids to kind of float through without us paying attention and engaging and looking out for them, they end up at they end up in juvenile court. They end up in these places and where we wish they were not. And I think, it's one of the things, my hope for things like the Village is to be able to build those types of spaces where we can have more intentional relationships with young people and catch them and develop a sense of a shared responsibility about their well-being. Because right now, I really do think that many people look at it as schools' responsibility, juvenile courts, police, but that's way too late in the process, actually.
Thank you, Councilmember Nash. Anybody else with questions? Councilmember Gregg.
Thank you for joining us today. I believe you said that we've become okay with 100 homicides. I find that disturbing that we're okay with that.
Yeah.
In your wisdom and research, do you know what has contributed to that mindset?
Again, I think part of it has been the fact that when things went up, I mean, in 2020, I mean, we shot up well over 100. So now it feels like 100 is actually a decline. I mean, I think that's one of the reasons why people have been talking about this, things are better. And true enough, they are better.
Better, but not good.
Yes, exactly. I mean, when you think back, I believe 2017, 2018, we had 60, and for the years, I mean, if you go back to like 2014, I mean, we're talking about in the 50s. So,
Kind of where my head was.
Yeah.
So to hear we're okay with 100.
Yeah, I mean, so when you think about these numbers in comparison to that, I mean, it's really jarring. I mean, it's 40 more families dealing with the loss of a loved one than say 4 or 5 years ago. I mean, so. Yeah, I hope that we can get back to that sense of urgency. I mean, because there are cities who do this. I mean, similar sized cities even that are not punching the numbers that we are. And like I said, so we could definitely be better. And the flip side is that we definitely could be worse. I mean, at this. When I last checked, Memphis was running a homicide a day. So if you...
And do I hear you say we just need a more focused effort?
Yeah.
Is that what I can surmise?
That's my worry. That was my worry when I reached out, was that there had not been really much of a concerted effort around this for several months. And really, the only news coverage I saw was saying violence is down. I mean, homicides are down. And that, I feel like, is dangerous.
Yeah, what you brought to light is that's not the whole story.
Yeah, it's not the whole story. And what I fear is once we settle into a pattern where 100 is normal, it gets hard to ever kind of put in the effort and the resources to get it back down. It's harder to do that than to hold it down and maintain it and maintain a lower number. So.
Thank you, Councilmember Gregg. Anybody else with questions for Dr. Nation? Okay. Dr. Nation, I really appreciate you being here. Thank you so much. If you don't mind sticking around till we're finished, if you've got time, I want to talk to you right after. Last thing I want to do, because we're going to be a little short on time, is I want to hear from Office of Homeless Services. I did put their presentation file kind of on the committee members' desks. And so let me recognize Mr. Clendenning for any things he wants to highlight in the report that he's provided.
Thank you, Madam Chair, and good afternoon. Good to see everyone. Just a few things to highlight. A few of those things are that between June 23 and July, July of 2023 and June of 24, there were 1,985 individuals were housed, and I think that represents a good trend. I think there's a paradigm shift toward housing, and I think that it's gaining momentum now, and we like seeing that movement. We've been monitoring relative to the ARP-funded agencies. We've been monitoring them. The monitoring is completed. The monitoring reports were sent out to all the ARP-funded agencies, and we will be following up with those. And that's been really helpful for us to be able to identify performance and where we can help them, where they need to help themselves and improve. So we are pushing forward with that as well. And the challenge is to continued support for the agencies and the community to increase capacity, and not only increase capacity, but to have a sustainability strategy for moving forward. And we met with one of the providers this morning about that. And, we're going to be meeting with all of them to make sure as their funding ends, or the original funding date ends, that they have an idea, they have a plan for moving forward so that these services can continue. These are the big highlights. You'll see that on page 5 and 6 after that, you'll see more information and data for Community Care Fellowship. And this is due to the funding they got before ARP, but it's the same services being provided. So we wanted to add that in there for your review. And also wanted to mention the affordable gap housing financing programs are now 6 of those have come online. So that's really good news. And just a couple of more items, sorry. Sorry, that's the big ones that I wanted to hit today. I don't want to waste your time, but I also want to know that we're always available for questions. We're here all night on council night. We're in the building, so if you ever have questions, Councilwoman Evans knows we're downstairs in the break room. So, but we're accessible and available. And if you ever have questions for us, we want to make sure that we can answer those and provide that information.
Thank you. I wasn't going to reveal your hiding spot. Now everybody knows where you're sitting.
I may be in trouble when I go back to April, but.
Do you want to make a comment while you're up there about the Strobel Center?
Yes, that grand opening is Thursday, and I believe it starts at noon. 11:30, excuse me. So we hope that to see, we'd love for all of you to be there. I think it's going to be a big day for the Strobel family and to honor Charlie, and a big step for Nashville.
Yeah, thank you for your hard work on that. I look forward to being there on Thursday. How about any questions for Mr. Clendenning or Office of Homeless Services while I've got him here? Okay, I don't see any questions. So, Commander Nash, you're recognized.
This may be a question more for the administration or us, but I think the Strobel home is a great step forward. It's really been a missing piece of our addressing the chronic, really troubled homeless. But I suspect it's going to be full almost as soon as it's opened up. And have we got plans for Strobel 2?
As far as I know, there is not a Strobel 2 in the plans, but of course it's in the vision, right? And that everyone knows that housing is a critical component. But our landlord engagement team is identifying lots of other permanent supportive housing that may not be funded by Metro government. But so right now, I think there's housing, and now we're trying to make sure that the people that can go into these into the housing have the supportive services they need, and that's a critical component.
Thank you. That's a challenge for us.
Thank you, Councilmember Nash. Any other questions? Thank you, Mr. Clendenning, for being here. Mr. Young, do you have anything you need to share with the group? No? Okay. I'll just give you guys a couple of really quick things. Mr. Young sent me, I had questions about kind of the heat and the message from the mayor's office about like when it gets to a certain temperature, what happens and those kinds of things. So Mr. Young sent me the heat SOPs. And so I'm happy to have those distributed if anybody else is interested in looking at those, because I'm going to send my questions back to him on what that process looks like. Also, I guess I wanted to mention, there's been more conversation about WeGo security and transit security around facilities, and so I'm getting some more information from WeGo, specific to their location downtown and, cameras and some of those details that they have. And then tomorrow I'm meeting with animal control specifically because if you are kind of engaged in your community, you may have noticed that there's a lot of conversation and chatter around anytime we get to like a high usage time of year, like July 4th and that kind of thing, where there's a lot of strays that end up getting dropped off, and capacity is either limited or none, then animal control has to give some different direction to community members about what to do and how to kind of, hang on to an animal and those kinds of things. And so I'm meeting with Director Harrington tomorrow at MAC. We're going to talk about some of those things because I think there's some issues that we're going to need to kind of probably surface that we can't wait for a new facility to be able to make some improvements. And so what do those improvements look like? So potentially I would like to invite Director to come here and share some information about MAC with everybody. So just want to give you guys those updates. And of course, we do have a white supremacist problem in Nashville with some of our parades and protests, in particular to the ones that we've seen this past weekend that there's questions about. And so I was talking with Director Darby about some of the things that we may hear or maybe potentially do a special called meeting or something like that related to some information that would be important to share with the public about safety related issues around some of that activity. So just to give you all a heads up about that. So with that, unless there are any other questions, we'll consider this meeting adjourned. Thank you.